Hi, welcome back to What Did You Learn? My name is Ahava, and I'm very excited to have here today somebody that we featured at our Future Forward conference. Her name is Kalia Doner. Kalia is an expert in physician content related to physicians, created for physicians, and we're really excited to have her here today to talk about how to do a great job in communicating with doctors and subject matter experts. Kalia, welcome. Thank you for being here.
Thank you. Thank you. I'm glad to be here.
Yeah,
so it's a subject that's near and dear to my heart.
It's near and dear to all our hearts. So, it's funny. I was just talking to a client who's also a friend, and we were talking about how one of the things that makes healthcare so challenging, particularly in a hospital or academic medical center setting, is that doctors sort of want to direct marketing and communications. They want to tell them how to do the marketing. And there's always this, sort of educational aspect that I've taken with them, where I sit down with them and I talk to them about patient-centered language and I talk to them about SEO data. What are some of the tips that you use to get great information from doctors, but also show them how to create really great content that's designed either for physicians to physicians or even for consumers?
Well, one of the problems, of course, you have right off the bat is that their schedules are so busy that it's hard to find the kind of time you need to establish that rapport. And if you're lucky enough to be able to spend a couple short sessions with them where you lay groundwork, you get feedback, you show them what you're thinking, it goes much more smoothly, but that's very hard to engineer. So in a way, what you try to do is create an artificial sort of replica of that. And you want to imagine in your communications with them, particularly if they're email, sort of, what's not just the facts you want to get across, but the tone and the way you want to get it across. And so one classic example is, doing a Q&A with a doctor on some new study they have or a new procedure they're doing at a hospital. I mean, these things are very important, but they're very internalized in the doctor, and so it's good to lay the groundwork where you really say very explicitly who the audience is, what you want them to get out of it, what you think their confusions or difficulty in understanding it might be, and then ask the doctor for his or her help in answering those questions so that they always feel like they're being brought into the process, not told what the process will be. And it's just a little trick, you said, look, I need your advice on this. There are 3 things I've been thinking about. Let me know what you think or what I might add to this. And it's really just a way to accommodate the sense of authority that they justifiably have, and to give them space to exercise it without interfering with your goals. I don't know how else to say it. I mean,
no, I hear where you're coming from. I think establishing that rapport, and it is always with people who are in charge of major situations to make them think it was their idea, right? To make them feel like the helper. So yeah, I think that's a great point.
Yeah.
So I want to focus a little bit on how doctors talk to each other, because one of the things that, the reason that we met is that you're instrumental in the creation of Doximity content. For those of you that don't know, Doximity is a social media platform for doctors. What have you found resonates with doctors the most? They are so busy. They're so taxed. Particularly this past 18 months or 700 years, depending on how it went for you. So tell me what you find works not when you're creating the content with them, but when you're actually creating content that you hope they'll consume.
Well, that's an interesting question. In Doximity, sometimes we are talking to people who are in the same subspecialty. And that of course gives you a lot of latitude, because they really do all share the same vocabulary and probably a lot of the same questions and knowledge. But when you're outside of a subspecialty or outside of a specialty, and you're going from a robotic valve replacement surgeon to an internist or a primary care physician, then language has to change. But at every point, you have to be very careful not to speak down to them. And while they may not know the lingo in the same way that someone in the specialty would, so when you write it, you want to put in definitions and put in explanations so that, if they run into something that they don't understand and you don't explain, chances are you've lost them because they don't feel good about themselves, and that's rude. On the other hand, if they run into something that talks to them as if they were in junior high school, that ain't going to work either. So it's really knowing who your audience is, whether they're in the subspecialty, the specialty, or they're outside of it. That's a first thing you've got to know. And then you find ways to speak to the level of knowledge they have.
Right. I remember, it's funny, I learned that I had something called sphincter of Oddi dysfunction. And I remember I was talking to a heart surgeon about it. And I said to him, yeah, I have this thing called sphincter of Oddi dysfunction, thinking he would know right away what it was. And he's like, where is that in the body? I kind of remember learning about that.
Where is that?
And it was like a moment in my life where I was like, oh, right. They also don't know everything, even though they pretend to, right? And so I think that that's a really good point.
And they can't. There's so much to know these days.
Yeah, absolutely. Yeah. But getting back to, okay, so not talking down to them, finding that art of communicating with them so that they understand the information and you explain things. But what kind of subjects do you think resonate with them? What are they hungry for? Why are they scrolling through something like Doximity or reading the New England Journal of Medicine? What is it giving them?
Well, in a way, those are two different questions.
Okay.
I think you can make an assumption that 99% of doctors are trying to find out what they can do to best help their patients. They have almost no time anymore. And so you've got to know a lot quickly. So there is a sense that if you can give them in almost a checklist of knowledge that they can apprehend quickly, that's very helpful. But the other thing is, and it comes through in Doximity, not New England Journal so much, is that they're very concerned about how to get through to their patients, because that's a real challenge. Compliance is a real problem. Understanding is a problem. Making sure that the patients are willing to tell you what their questions are. And so a lot of things that appeal a great deal have to do with improving the interaction with the patient as well. And I think that's getting more and more charged as a topic as we do more telemedicine, as we, those things make that even more difficult for some people. Although sometimes telemedicine is extraordinarily, you just can't believe how well it works,
Yeah.
But there are people for whom it's more difficult. And so, that interaction with the patient is a real challenge. So it's a combination of knowledge that empowers you quickly, and then advice and help in how to enhance compliance and understanding.
Yeah, it's interesting that you say that, because listen, doctors are wonderful people and they're dedicated their lives to saving other people's lives, and internists, I think, have it the worst, because like you said, they have to know the most about a lot of different things, and they have to figure out how to get their patients to be compliant. When you're writing for a doctor and you're thinking about that improvement in patient interaction, doctors are data hounds, they want data. So do you look at health literacy? Do you look at studies that have been done? Do you look at, these are tips I've learned from being a great, doctor and getting compliance? Like, how do you write articles like that? Because I don't think anybody's really great at that.
Right. Well, there are two. So, there are studies that have to do with what enhances compliance and what patients understand and don't understand. There aren't as many as there are on other topics, but they do exist, and they're always good to look at and to refer to. Because there's not a lot of discussion of this and not a lot of research on it, it's a challenge. You're identifying a challenge, but that doesn't mean we should step away from it because it's wanted so much. And if you're speaking, if you're Northwell Health and you're speaking to Northwell Health doctors, then you can use doctors in the system to talk to the other doctors in the system, and the credibility gap is overcome pretty well that way. That's an in-house technique that works.
Right. No, that makes sense. I want to go back to sort of, what cuts through the noise for doctors. So, one of the things that we always talk about is storytelling, and how storytelling, our brains are primed for narrative, and we're always thinking about, how do we learn? We learn from stories. Do you find that when you write, even articles about like the latest, changes in the way that you approach hip surgery, do you find, and that's for specifically a doctor, do you find that telling stories grabs their attention in the same way?
In Doximity, we often are able to add in, 2 short paragraphs, but nonetheless, and a picture, say, about a patient story that relates to that. And if you can't do that, or there's not room for it, or it's not available, I really press to have a picture and a quote from a doctor who's involved in whatever that technology is, or that surgery, or that medical procedure. Because otherwise people just bounce off the surface of the words, whether they're printed or online. And if you can bring some kind of humanity to the page, whether it's a real life story or the doctor himself speaking, it does change the stickiness.
Sure. Sure. So, and then my last question is really centered around, so we talked about specialists, we talked about internists. I want to know about pediatricians and pediatric specialists.
When you talk to pediatricians, you have to remember they're not 8 years old. Their patients may be.
They may want to know how to explain it to an 8-year-old. Like I found during COVID, a lot of the very famous pediatric hospitals did an unbelievable job of writing blog articles, creating children's books, like explaining COVID to all these different age audiences, because kids needed to know how to understand what was happening.
Well, I think most pediatricians understand that children are interested in and understand often a great deal more than we give them credit for. And so that applies to people who write for them as well. Kids may want things simple, and there are some details they're not interested in, but they're not oblivious, and their emotional realities are just as deep and complex as an adult's, really. And so you need to acknowledge that, and you need to address it in a language that's useful to them.
But do you find that they're looking for different types of information than other, types of doctors?
Well, I mean, they're looking for lots of information that they can pass on to a family, and that comes in categories. That's information about what the family needs and must do to make the child's life as good as possible, what the family needs to understand about whatever the health condition is, what kind of support services they need in order to be able to do their job for the child, because caretakers are beset. I mean, that's a very difficult role. So you need to be able to address the caretaking needs that they have just as well as the medical needs.
Kalia, where can people find you and more of your fabulous wisdom?
Well, I don't tend to spout out like this very often.
That's it, guys. You've gotten all she wants to offer.
You can certainly Google me. My various books will come up. My website will come up, www.kalia, Doner.com.
Great. Awesome.
Thank you.
Yes, thank you very much. And for our audience, you should know this is our second to last episode of What Did You Learn? We're actually going to be sunsetting it because it looks like the pandemic is fading out. So stay tuned for next week when we do a wrap up of all of our guests, and I'll let you know what I've learned.